Hospital Rooms is an arts and mental health charity that we started in 2016 that aims to transform locked and secure mental health units with museum quality artwork. The project at Woodlands started in the really early days of Hospital Rooms. Tara, the modern matron here, had seen an article about our very first project at the Phoenix unit in southwest London and St George's Trust, where 12 artists had come, worked with the community and really transformed the clinical spaces in a unit providing care for people with a diagnosis of schizophrenia. She immediately got in touch saying, please come to Woodlands, we would love to do an art project with you. So we spoke to Tara and Maggie, the art therapist, on the phone, and we had the most vibrant conversation about how art could support the care that they're giving, and we were so excited to work with them.
The environment at the Woodlands has really changed recently. We've had the Hospital Rooms project come in and spent some time working in some of our areas, and it's been a fantastic collaborative piece of work with our service users because they've been involved right from day one. And these projects have become a real talking point amongst both patients, staff, relatives alike, and they've been really sort of beneficial to people's care. My favourite piece of art is definitely the fence on Everset Ward. I work on Poppy Ward, however I think we get the best of that fence because we see it right through the whole ward every time you look out a window. It brightens everybody's day.
So I made a work called Speaker's Corner for the communal garden. It's a bright, vibrant, colourful artwork that covers all the 250 slats of the fence. Each slat is hand mixed, it's a unique colour, and each slat becomes an I, the personal pronoun I, that could be added to. I'm inviting service users and staff to add their own messages, ideas and artworks to these slats, and Speaker's Corner will become a big collaborative, long-term artwork that could be added to over time. It seemed important to continue this artwork within the unit, so I created an extension of Speaker's Corner that winds its way around the review room in Everset Ward, and I've painted dozens of small eyes that continue all the way around, and they lead your eye around the space.
At Hospital Rooms, we think really carefully about the artists that participate in our projects. They are what we call museum quality, which means that they're professionally trained, they have some kind of participatory aspect to their practice, and they've worked with communities, and they're really empathetic about the sites that they work in. All the artists came to Woodlands for an initial visit where we walked around the spaces and encountered them for the first time. We also held a number of gatherings and workshops where they could interact with the community and really learn about their experiences of the spaces. After that, they went around and thought about what they had heard and came up with proposals that not only were compliant to the clinical regulations of the spaces, but also took on board people's lived experiences, their wants for the spaces, how it could convey something of the human experience of being in these spaces. Rebecca Byrne chose one of the most challenging spaces at Woodlands, the 136 suite. When we encountered it for the first time, it didn't have any windows and it was a very bare space. She heard that service users were very familiar with a local coastline called Shingle Street Beach and used that as inspiration for her artwork. She painted the whole space in calming tones of yellow and blue and then repeated a pattern of whelk shells throughout the space. They reference a recovery trail that exists on Shingle Street Beach that was started by a pair of friends who had a diagnosis of cancer, and they were later added to by the local community. Photographs of Shingle Street Beach are in the entrance of the space to give a cue when people enter. Carl Rowe created Have Strength, Find Peace for the Tribunal Room. He asked service users to tell him about words that they associated with a memory of sitting under a tree, with the hope that he could convey something of that feeling in that space. Strength and peace were words that came up again and again. He took photographs in a local park in Christchurch and overlaid the text onto the photographs. He also collected acorns and chestnuts, which he ground up and used as ink to use on his prints. They're now installed in the Tribunal Room at Woodlands. We were absolutely thrilled to have visionary photographer Nick Knight participate in this project. He allocated a personal project that he had done at the Natural History Museum in London. He accessed thousands of botanical specimens in the herbarium and photographed them on light boxes. He worked with us to print these really beautiful images that look as if they're coming off of the page. One of the challenges of the spaces in Lark Ward was that the acoustics of the space weren't very pleasant, and that was raised by a service user during one of our workshops. Nancy Milner took that challenge on and created 6 canvases in the hope that the fabric might absorb some of that sound. We worked with Nancy to make sure that they were compliant to the clinical space, and she created some really beautiful images for the room. Tal Rosna is a BAFTA award-winning video artist, and he did an animation workshop with service users. He used the principles of animation to rework the design of the room at Poppy Ward, where geometric shapes of the room are recreated in really vibrant colours. The Hospital Rooms project has succeeded in creating spaces that support people to be able to give a really high quality of care during their working day. The spaces that we've created are extraordinary and they are unusual, and it makes Woodlands a very unique place to work.